Hi, my name is Brian Poludniak. I'm the head physical therapist out at Health Solutions Centers. We are located in Lorain and Vermilion, Ohio on the west side of Cleveland. We're a physical therapy clinic as well as chiropractic clinic. Today I'm here to talk to you about a hot topic in the sports community. It is Robert Griffin III's knee injury. It actually occurred last Sunday in a game against the Baltimore Ravens. I'm going to talk to you about the knee and the mechanism of that injury that occurred last week. This is actually the right knee. He damaged his LCL, which is this ligament that runs along the side of the knee on the outside. It stands for lateral collateral ligament. What happened last week was he suffered a blow to the inside of his knee, which forced his knee to go out to the side, outward. Now, the job of these ligaments on the side, you have one on the outside, one on the inside. The job of this one on the outside that he injured is actually to stabilize the knee from blows such as the one he took. So it prevents the knee from buckling out this way. These ligaments are essentially strong rubber bands that prevent that motion from happening. So it stabilizes the knee when you're cutting, changing direction, any kind of stuff like that when you're moving agile, like a quarterback such as Robert Griffin does each week. Now, what happened was he suffered a grade 1 sprain of that ligament. So a grade 1 sprain is essentially defined as just stretching that ligament. So when he took that hit, it just put a little pull on it, caused some discomfort, probably had some swelling. That's why he was limping around last week. Now, a grade 2, if he would have suffered that, is a partial tear. So that means there's a partial cut in this ligament. It may or may not be surgical. You probably have to do some therapy and take more time off. Now, a grade 3, on the other hand, is a total rupture of this ligament, meaning this is completely severed off, definitely a surgical matter. Like I said, he had a grade 1 sprain, so aggravated a little bit. He took some time off this week. He's been doing some rehab, I'm sure, getting ready for this game. What you'll probably see, I'm assuming he'll play Sunday morning. He's going to have a brace on it. It'll probably have lateral supports and medial supports each side of the knee to help stabilize it when he's running around, cutting, moving around the pocket. Now, just having that brace on, I'm guessing probably isn't going to be enough. Now, Cleveland this weekend is calling for wet conditions, cold conditions. They're on a natural turf. That's going to be a little bit unstable for any kind of quarterback that's very mobile like that, or running back. Anyone that's moving a lot, changing direction, is going to put a lot of strain on that knee. I'm guessing any kind of irregular hits or any kind of twisting that knee is going to re-aggravate that injury that he suffered just 7 days beforehand. So you may see him leaving that game early this week. It'll be very interesting to see. It's a huge game for Cleveland. Both teams obviously in the playoff hunt, and we'll have to see how it plays out. Okay, that is the information on his knee. We'll see what happens Sunday. If you want to check us out on Twitter, we're at HSC Therapy. We'll also be on Facebook very soon. Thank you for tuning in.